Hi everyone, my name is Anna Jacobowitz. I am a four-year senior from London, England, currently living in New York. I am looking to pursue a pre-medicine track and concentrate in neuroscience, so I'm very excited to talk to you today about the healthcare inequities that I have observed both within the hospitals and also a little bit within the medical field of research. So, to start with, I will say that I am coming from a very privileged point of view. I have never been judged or put at a disadvantage within my treatment because of the way that I look or where I am from or for financial reasons. I've always received optimal health care, and it's always been a very efficient experience for me within hospitals. That being said, I have definitely noticed that the financial burdens that are put upon a lot of people within the US, especially, is significantly more than within the UK. The UK has the National Health Service, also known as the NHS, where citizens of the UK are able to have access to all medical care. And by having this, even though it does come, of course, within your taxes, this way it is more accessible for all citizens of the country, and there's never a concern about not getting the treatment that you need. I think the US can definitely implement a few of these ideas from the NHS. And I think also it could definitely keep the structure that it currently has, but it will definitely need to be reformed. I think one of the ways going forward would be looking at the federal programs such as Medicaid, in which the eligibility criteria is still quite narrow, and it needs to broaden the range and help more low income families and individuals who are unable to get access to the treatment that they need or are too worried about the financial burden that it will have on them. And by kind of increasing the eligibility criteria, more citizens of America will have access to it. Secondly, within the medical field of research, I have studied or worked at two institutions, one private and one public. I have definitely noticed that there is more diversity within the public institution. It's a university, both universities actually, and I wonder if it has to do with not only the admissions but also to do with the cost of a private versus public university institution, and kind of looking back at the systemic racism over time and how public institutions are more accessible to a wider variety of cultural groups. So that's kind of my experience. I am really happy to be able to share some of this with you today. And if you would like to talk to me further about this, I'd love to just email me. Thank you.
Hello everyone, my name is Sinai Robinson and I'm one of the designers for this anti-racist course, and I want to share a personal story about health equity and health inequity. So before I was born, my grandmother passed away. My grandmother was diagnosed with a condition called polyps, which is an abnormal growth of tissues, and she had this within her intestines. The doctors presented two different surgical solutions to my family, but pushed the more invasive one. And because of that, my family was only seeing the one option, and that one option was more invasive, leading to my grandmother having the invasive surgery. So when the doctors performed the surgery, they actually performed it not so well. And because of what they did during the surgery, they ended up perforating my grandmother's intestines. Due to this perforation, my grandmother ended up becoming septic, which is a condition in which bacteria leaks into different bodily fluids. Because of this, my grandmother experienced a lot of different things, such as dementia, tissue failure, and organ failure, and ultimately ended up passing away. So the reason I bring up this little anecdote about my family is because health equity and inequity is about how a doctor treats their patients as well as how a doctor informs their patients. My grandmother was an immigrant from the Dominican Republic and could not speak English, and our family had a lack of resources when it came to education as well as health. Our family had no idea of what the surgeries meant or what they would do to my grandmother, and it was up to the doctor to tell them that the risk of the surgery would have been what my grandmother went through, as well as perform the surgery well enough so my grandmother was at prime health. This is all due to the fact that systematically, people of color are treated differently in the health field, and their health is considered less than when it comes to other citizens of this country. So I hope that this story lets you know that health equity and inequity is something that many Exonians can face and something that you personally can think about and change.